Ellebarbii, and I'm here with Dr.
Makhlouf.
And today we are going to talk about my plasty. I'm very excited for this. I wanted to share with you guys a little bit about my plasty. Today he's just going to explain to me exactly what he did throughout the entire procedure so I can get a better understanding of how he did my nose. And Dr. Makhlouf, take it away.
Okay, the first step is really the planning and to see what we want to do, because I don't think that without a plan you're going to get where you want to be except by chance, and you cannot depend on chance when you go to the operating room. We had this photo. One of the things that you were interested in having done is narrowing the base of the nose and bring it together. We can confirm this. There was a little bit of asymmetry for the nostril. And the other part that you didn't like is what we call the roundness, the bulbosity of the tip. It's a little bulbous, and we needed to kind of make it a little bit more sexy. The other thing that we talked about is narrowing the wall. From here to here was a little wide, and particularly on this side, we talk about narrowing this. On the profile, the tip just did not have projection. It fell down, kind of a thing. We had tried, if you recall, we have put some fillers to make sure this is what you wanted to do. So we have placed some filler at the tip. You liked it. You say, you know what, I don't want to keep putting fillers. Let's come up with a more permanent solution. And so when you look at the nose, what you really would like to have is the tip just higher than the dorsum. That kind of give us a plan of what we want to achieve.
My nose looks a little swollen in that one, guys, so don't
Well, that's okay. We can see now much better definition in the tip, and this is why the light is reflecting here. You can see that the nostril are a little bit better. There's a reaction for the suture that is now gone. You can see here at the base, and you can see that the tip now is higher than the dorsum. And you can see a slight elevation of the tip with respect to the dorsum. A nice little angle between that part here and that part here. We can visualize this line, we can visualize this line, and then we can see that the tip is higher than the dorsum. Where to put a straight line here, you can see that the tip is a little higher than the dorsum. This is the before and after. I have these drawings for simplification purposes. This is the upper part of the nose. This is the middle segment of the nose, and this is the lower segment. In that area is referred to tip plasty. That's not only with the tip, because we're also going to work with the base. They are all kind of connected. You can see this cartilage, it goes like this, and it has a curve. You can see that curve again from this base view. It has this curve. This is the view from the top. If we want to correct things, we might have to work on this component to make it more firm. If you remember earlier in Elle's nose, we said we wanted to make this a little narrower because it was wide, and this is what's depicted here. The red is what is removed, and this is the resultant scar. Now, we also wanted to narrow the base, and we wanted to bring this inside. And so what we did for her is we resected this cartilage, and we put a suture to support that narrowing. And that suture is a permanent suture in this inside. But because we wanted to combine with the narrowing, so we ended up with this resection plus this resection gave us this resection, and we end up with a small little scar here, a scar at the base that is not visible anymore. What we also did is you can see the curvature of the cartilage. Curvature is wide. We wanted to make it more narrow. So we put suture within the cartilage to change the curvature. Sometimes we like to support cartilages that we had, and we can suture them together. We did that, but we felt that it was not sufficient. So we ended up going to her ear, got some cartilage, and because we had supported with the suturing, put some cartilage here at the tip. You can see how it changes from this squarish fashion to this more sharp tip fashion. So in summary, what we did, this resection, we narrowed the cartilage here, we supported the base, and we put a tip graft.
So when it comes to doing nose jobs on other ethnicities, do you find yourself making the same noses for different ethnicities, or how does your
the thought process go?
Yes.
Well, it has to do with what they really want, and that's why I think it's an important discussion to have before the surgery. So sometimes I give different options so that people can clarify in their thought process what is it they'd like to have. I believe that irrespective of any ethnicity, one would like the tip to be higher than the dorsum, because otherwise it gives this beak-like appearance that no culture particularly likes. Some of my Chinese friends tell me that in China they like big noses because it means that it's a function of wealth. Some little variation, but those can be discussed once we know what the structures are, and then we can say, okay, I want to modify this structure, and we'll go about modify that particular structure. We don't do the same thing for everybody. We want to have a nose that's going to look good today and look good in 30 years.
So what's the difference between a full rhinoplasty and a tiplasty?
So with a full rhinoplasty, we might be having to take a hump down. We might have to work on the septum. We might have to sand some of the files, some of the bone in order to make it narrower.
The only thing that I had problem with was like my bulbous, my bulbous
Bulbosity.
Bulbosity. It's a weird word to say sometimes.
No, you need to think of the bulb of a plant. You know what a plant, the bulb, and then you say bulbosity.
Bulbosity. For me, was there any fat reduction? Did I need to reduce any of that?
No, we didn't remove any fat. We just removed skin here to make it thinner. We removed a little bit to correct the curvature, but no fat from the tip was removed because we were adding cartilage, and that cartilage is small enough and thin enough that it's going to stretch the skin upward and giving a more defined tip.
How long do you have to wait for your nose to heal properly?
Well, recovery is a spectrum. It's not just one incident. You turn the page and today you're not recovered and today you are recovered. It's a spectrum. Usually the pain is very minimal. These structures don't have too many nerve fibers. The next day, the patient are about and doing their own thing, don't have any pain, they can drive, not taking any narcotics. They have a little tape to support the structure and help them with the swelling. The tape and the suture are removed within 5 to 7 days. And there is a peak in the swelling, and the peak is at 6 weeks. This is the way the body heals, and everywhere in the body, maximum swelling is at 6 weeks, and then it's going to slowly go down. More and more definition will be achieved.
What are some things that you should avoid when you're getting a tiplasty or when you think about getting a rhinoplasty in general?
We don't like people to get involved in contact sport. Any aggressive aesthetic procedure, peels and so on and so forth should be avoided. Things that people do for their skin, they should be delicate enough because they may not be able to feel. The circulation is not back to normal, no harsh chemical and no direct trauma. And believe it or not, sunscreen is good.
Any medications that you recommend or do you prescribe them?
For the surgery, we prescribe ahead of time some pain medication and we prescribe antibiotics.
Well, thank you, Dr. Makhlouf, for me interviewing you about my tiplasty. If you guys are wanting to get one today with Dr. Makhlouf, you can go ahead, book through his website. If you have any more questions, Dr. Makhlouf does have a social media where you can DM him personally. He'll answer the questions that best benefit you. Thank you so much again, Dr. Makhlouf.
Thank you. Thank you. Thank you for your time. Thank you for willing to showcase what we have done for you.
Yes, follow me on social media. You can follow Dr. Makhlouf on social media as well. And thank you guys so much for joining. Have a good one.